So poor posture can affect your physical and emotional well-being. It can also disrupt your sleep. In addition to increased tension, poor circulation, and neck pain, you might also experience emotional tension related to chronic pain. Unfortunately, taking time to consider, whether or not your sleeping position may be negatively affecting you is an important step to take in alleviating these issues. You may be able to minimize stress on your back, neck, and shoulders by adjusting your sleeping position. So in this video, I'm going to tackle this topic in 3 parts. Part 1, I'm going to explain how to assess your current sleep posture on your own. In part 2, I'm going to explain how to improve your sleep quality. And finally, I'm going to show you how to get better sleep and explain how I assess sleep posture with a chiropractic examination and radiographic findings from an x-ray. So here's the first of the 3 parts. Now, part 1, assess your current sleep posture on your own. So the most important thing to do in order to improve your sleep posture is to choose positions that helps keep your spine in alignment, right? If you have chronic problems with headaches and back pain and heartburn and sleep apnea and fatigue, your sleep positions may be exacerbating these problems. So it's good to sleep either on your back or on your side. And if you tend to sleep on your side, place a pillow between your knees in order to keep your hips aligned and to prevent you from twisting to the rest of the knee, your knee on the mattress. So if you tend to sleep on your back, you can also place a pillow underneath your knees to make sure your back is in the optimal position. However, be aware that if you snore or have sleep apnea, this position will only exacerbate these issues. So if you're a stomach sleeper, then you likely need to work the most to improve your sleep posture, as this is typically considered the worst sleeping position. In fact, in over 15 years of clinical practice, I can tell you the majority of people getting back surgeries are stomach sleepers. Avoid it like the plague. If you can't, because it's the only way you can sleep comfortably, or it hurts to sleep any other way, those are red flags that you are suffering from subluxation of the spine or spinal decay. Only a doctor of chiropractic is trained to assess your spine and fix this. So like a dentist, you wouldn't ask any other doctor to assess and fix your cavities in your mouth. Who would ask a medical doctor to treat your dental cavities? Likewise, you would never ask anyone else but a chiropractor to assess your chiropractic subluxations. Understand? So sleeping on your stomach forces you to turn your head to the left or to the right, creates pressure on the spine, and it flattens your spine. And so if you use a pillow, it also pushes your head higher than the rest of your spine. And this can lead to pain, numbness, and tingling. It can also lead to degenerative disc disease, disc bulges and herniations, and stenosis. And when unaddressed, this can lead to things like back surgery. So if you're a stomach sleeper or find yourself waking up on your stomach, you can place a thin pillow underneath your pelvis and your stomach to try to take some of the pressure off your neck. Again, I can't stress this enough. If it's too difficult, this is a red flag. It's a sign you need chiropractic spinal adjustments to kind of coach and train your back and your posture to improve alignment and overall spinal function. Understand? Number 2, change your sleeping position. And at first it will probably be challenging, right, to sleep in a position that's not the one that you're used to. However, over time, you're going to become more comfortable. Number 3, use lots of pillows. If you want to start sleeping on your back, place extra pillows underneath each arm, right? One under your knees and possibly even one on each side of your torso. And if you want to sleep on your side, place a pillow between your knees and 1 or 2 pillows behind your back to prevent you from rolling, onto your back. So by using pillows, you help your body stay in the new sleeping posture. Number 4, be patient, right? Since it's difficult to control your body position after you've fallen asleep, trying to change your sleep posture can be quite challenging. However, over time, your new posture will improve your sleep quality and will eventually, feel even more comfortable than your old posture. And number 5, improve your posture during the day. So in order to improve your posture during the night, you should also work to improve your posture during the day, as this also contributes to the aches and the pains that may, force us into a particular posture. You may not immediately know what proper posture should feel like, right? So you should check your posture against the wall several times a day as you begin, a back and shoulder strengthening routine. Again, after chiropractic care, you'll know what good posture feels like. So standing against the wall. So for most people with poor posture, their shoulder blades, they don't touch the wall. So pull your shoulder blades down and in so that they, connect with the wall. Next, lengthen your neck as if someone is pulling the back of your head up. Move it back until your head touches the wall. Move your chin until it's parallel to the ground. Make sure you stand with equal weight in both legs. So move to a mirror and mimic the pose to ensure your neck and shoulders are straight. Pull your shoulders down as far as possible. Tighten your abdominal muscles. And consider seeking the help of a chiropractor first and foremost, as safe, natural, and effective spinal adjustments can gently break down any scar tissue setting between each joints. And most of the time, by fixing the underlying issue, the spinal subluxation or spinal decay or sticky, stiff joints, the body finally is able to heal and the tissue can finally regenerate and heal. So keep in mind, your body does the healing. Now, on occasion, I might recommend things like physical therapy or a personal trainer to support you during or after your chiropractic treatment plan if you have continued trouble maintaining proper posture, who can show you stretching exercises that help strengthen your core. So I want to be very clear here. You have to restore spinal function and motion, the normal spring-like motion of your spine first, as it acts like a windmill or a pump for the central nervous system. So the adjustment, listen, the research shows in adjustments you get improved brain function by 20%. Your reaction time improves. It strengthens muscle to what 3 weeks of weight training can do. And all this with one chiropractic adjustment. Combined adjustments further break down the scar tissue between joints and restores both the mechanoreception or movement brain sensors and proprioception or body positioning sensors. So these are the sensors that are responsible for what Nobel Prize winner Dr. Roger Sperry says 90% of the nutrients your brain requires comes from the movement of the spine. So watch my other video, Broken Brains or Rethink Chair, on my Facebook page for a complete understanding of this mechanism. But bottom line, chiropractic care first if you want to get rid of the cause of the problem. So the stretching and the exercise, even massage is available after your chiropractic adjustments as a supportive and complementary treatment to your chiropractic treatment plan if needed. So skipping chiropractic is simply not an option unless you want a Band-Aid approach or settle for pain management. And also a quick side note, some chiropractors don't even physically adjust the spine. Some go, to these other modalities and never actually address your spine. So keep in mind here, would you visit a dentist who claims you have a dental cavity issue and they want to drill or replace your teeth if they never took an x-ray? Now, sometimes x-rays aren't possible. You may be pregnant. You have other personal reasons. Of course, we can still assess your spine and posture, but without x-ray or other advanced imaging, we are still in the dark. And as I'll explain later how I use x-ray to literally help you sleep better in the part 3 of this video in the training. So part 2 of 3 is improving your sleeping quality. Number 1, assess your current mattress. Mattresses generally should be replaced about every 10 years and more often if you can afford it, all right? However, if your mattress is becoming saggy or lumpy, if you're waking up with pain and aches, and if you find that you sleep better when you're away from home than in your own bed, it may be time to start searching for a new mattress. So, number 2, learn about how to choose the right mattress. So there are so many things to consider when purchasing a mattress, and a mattress that is best suited for you specifically. So you should take some time to learn about how to choose a mattress. And it's a good idea to choose a firmer mattress, as a firm mattress provides better support for your skeleton. And you want to ergonomics. You want to think ergonomics. You want to think, how do I support my curves as I describe in this video? So if you can't afford to replace your mattress, then you can try flipping over your current mattress, and you can even place a piece of plywood underneath it to order to kind of provide more support, right? So number 3, assess your current pillow, right? There are many factors that affect how often you should replace your pillows, including the quality and the type of filling in your pillow. However, like your mattress, if you wake up with a sore neck or a headache, it's probably a good time to look for a new pillow. So to help you determine whether or not your pillow is worn out, you can perform the fold test. Fold your pillow in half for 30 seconds and then release it. If it doesn't spring back into its original form relatively quickly, it's likely time for a new one. Finally, if you notice that your pillow is very lumpy, or that there's a large dent where your head usually goes, it's likely time for a new pillow. Number 4, learn about how to choose the right pillow. As with choosing a mattress, there are many things to consider when choosing a pillow. So take the time to learn how to choose the correct pillow for you. Since you're going to be likely, learning to sleep either on your side or on your back, you're going to do best with a medium thick to thick pillow that provides good support for the neck, like I have here. So make sure that any pillow that you purchase keeps your neck in a straight line with your spine. You don't want the pillow to make your neck go higher, like this, or lower than the rest of your spine. Also, we can always order a custom pillow for you, like the one I have here, right? Which both supports your neck curve when on your back and side sleeping position, so you don't compress the cartilage and the nerve tissue in your neck while you're sleeping. So this pillow I have here cost me around $100. And if you're interested in it, just call the office, and at your next visit, I can measure you and order a custom pillow. This is the pillow my wife and I have used for the past 20 years, right? Number 5, check the temperature of your room. Make sure the temperature in your room is cool, but not cold. Most people sleep best around 68 to 72 degrees Fahrenheit, or 22 degrees Celsius. Science has shown it's best to be cooler at night. So if you're too cold, they have shown to keep the room temperature like at that cold, right? Add blankets if you get cool like I have here. You can add as many as you want. Number 6, eliminate noise. Right? It's kind of obvious, but grab a noisemaker. Get an app on your iPhone that makes noise, a humming sound or wind. Sometimes with my kids, we'll use like an ocean sound. Part 3 of 3, getting better sleep. Number 1, avoid heavy, fatty meals before bed. Especially if you wish to sleep on your back, you should avoid eating a large meal before bed. So give yourself at least 2 hours to digest your meal. And if you consume a large fatty meal, you're more likely to feel uncomfortable while sleeping. So try to avoid eating a heavy meal after around 8 p.m. Number 2, walk around for a few minutes before going to bed if you have just risen from a seated position and you are still in that position beyond 30 minutes. Then it's likely your pelvis is tucked forward and you have poor posture. So do the wall test and walk around shaking your backbone, right? Your hips and your spine. Do that around your house to loosen your muscles before you try going to bed. Number 3, go to bed at the same time each night and wake up at the same time each morning. So in order to get the best sleep possible, it's important that you create a sleep routine that you can stick to every day of the week, including weekends. By going to bed and getting up at the same time each day, you're going to help your body know when to be ready for sleep. If you end up going to bed later than normal one night, you should still do your best to get up at the same time. In this way, you don't disrupt your routine quite as much. So if you feel very tired, try taking a short midday nap to help you, rather than sleeping in later or going to bed earlier. Number 4, have a bedtime ritual. So each night before going to sleep, have a ritual that you do in the same order, to signal your body that it's time to go to sleep. For example, you might brush your teeth, wash your face, do your YTLM stretch, and change into your PJs. You might go up, do some gentle stretching or some yoga maybe. Finally, right, you can get into the rest mode or the reading mode with your kids, like what I do. And remember, avoid electronics, avoid the smartphones, the televisions, laptops, anything with a blue light, all right? Blue lights are a no-no, messes with your brain health, right? So while entertaining, the backlights from these devices and the blue light can be stimulating, but it can suppress melatonin production, so you're not sleeping very well. Number 5, move around when you wake up. Walk around, swing your shoulders in their sockets, and do very little light stretches. This can ease the pain and the stiffness, improving posture during the day. Number 6, how I assess your posture using a chiropractic examination and x-ray analysis. And this is the big secret not taught in chiropractic schools. In fact, I've been developing it over 15 years of clinical practice. And that, folks, is evidence-informed practice. See, healthcare, strictly evidence-based, is mostly rat and animal science. Hardly any of it human. It's a starting place, but not an endpoint. So when you take into account that humans are not rats, and that over 86% of our basic science research is not human research, it's rat research specifically. We have to think outside the rat, way outside the box, and implement from clinical experience what works for our human patients. This is the newer health promotion model of healthcare. That's what we call evidence-informed care. So this is how I help my patients assess proper sleep posture using a chiropractic examination and x-ray studies. So to do that, I'm going to go ahead and sleep tonight, and then in the morning, I'll take you back to the office, and I'm going to show you some x-rays, and I'm going to explain how we do chiropractic examinations and an x-ray analysis for your sleep posture. So I'll be there. Well, I'm going to bed, but don't worry. I'm just going to pause here, and then like that, we'll be in my office. All right, so I slept last night, and it's morning. I'm here, and I'm going to show you an example of what I mean by sleep posture and how I specifically use an evidence-informed based approach when I'm actually looking at radiographic films and looking at x-rays in order to come up with a way to sleep, with proper sleep posture based on a specific set of x-rays. So first of all, before I go into the x-ray part of this, what I want you to understand, what we're looking for chiropractically for the examination, I want to see a nice normal neck curve, nice curve in the mid-thoracic, nice curve in the lower back. And these 3 curves in the spine are really critical, because the story is, if we can maintain the proper curvature, the textbook normal curvature, then the spinal cord that sets through here, it's going to relay that information from the brain to and from every tissue, cell, and organ in the body. So the idea here is that when we have bad posture, or the curvature is bad, what it does something to what we call nerve signaling. It lowers or dampens that nerve signaling. So the bottom line, what we're understanding is that when that happens, it diminishes the function to the brain, right? So just know, it's the sticky joints that we're after, not just about pain. Pain is one parameter that we look at, but pain happened after the matter. So we're interested in which of these joints are sticky, which ones are immobile, and we want to work on correcting the adjustments to that area, break up that scar tissue, improve what we call proprioception, or that body positioning sensing into the brain, because the brain is both chemically sensitive, but more so it's mechanically sensitive. And so when we sleep the wrong way, so if I'm sleeping on my stomach, you flatten your lower back, and so you end up with a straight lower back. That puts stress on the nerves, and also, as I already talked about, it can cause degeneration to the disc, it can cause bulging disc, herniation disc, and even a stenosis. So what's a stenosis? Well, so here you have a normal joint. And again, I'm not just after, the bone being misaligned, putting pressure on the nerve, which has been, chiropractic philosophy for 100 years. I'm after more than that. I want all 6 different ranges of motion of that joint to stay functioning properly. And I would argue that how much spinal motion we need comes from our ancestral health, which is 8 to 10 miles a day. So 15,000 steps generates that motion of the spine. So when I'm walking, I have this mobility and motion to the spine, and this movement of the hips to the joints. This segmental movement is critical, the tiny segmental movement. That is what Dr. Roger Sperry says acts like, the movement of the spine acts like a windmill, right? So you've got the windmill, and you've got the positioning sensor here. You've got your sensor detecting the mechanical energy of the wind, or if it's a river, it's going to be the river. For you and I, it's our walking and the movement of the spine. That converts mechanical energy into the nerve impulse. So this is your brain. This is your central nervous system, your brain, your spinal cord, the nerve roots, in every tissue, cell, and organ supplied. So when you lose those curves, you lose that posture, you're accelerating, you can't see it on my, you're accelerating spinal decay. Your spinal decay because of that immobility. So it can be trauma related, but more importantly, what we're understanding, it's not just trauma related, it's immobility, right? So when you come to my office, I always point that out. I show you a little model of this spinal decay. I'm going to show it to you. So it looks like this. And so we got taught, you and I got taught, this is an example of arthritis, right? Arthro meaning joint, itis is inflammation. So you and I got taught that arthritis is an aging issue, right? Well, let me tell you something. This is an example of arthritis. And what happens is when the joint becomes immobile, for whatever reason, could be an injury. More importantly, and I would tell you 80% of the time, it's because of immobility. It's because of our sedentary lifestyle. It's because of sitting. These are the reasons. We're not hitting that 15,000 step goal. 10,000 steps keeps your heart doctor happy, right? 15,000 steps keeps your brain health happy, right? We want brain health, it's everything. So when this becomes immobile, in time, we know 2 weeks of an immobile joint, we have histology studies showing these collagen fibers that lay parallel have scar tissue. So they do this, and that fixates the joint worse, and that's what we're looking for on these x-rays. I want to see those areas of what we call subluxation. I'm looking for degeneration too, degeneration of the disc. When I do a palpation on the physical exam of the patient, I'm checking their full spine. Literally, what I'm looking for, every single joint, I'm looking for, I call it a spring-like effect. It should feel spongy when I'm doing this, right? Once in a while, it'll feel like a board, as I explain it. I'm trying to feel sponginess, it feels like a board. So I know it's stuck, it's not moving right. What direction it is, not that important. I know it's immobile, and we need to fix this. We need to work on rehabbing this with chiropractic adjustments that are specific to that area. And so, because what happens when that joint is stuck, I know, more than likely, you're on this road. We don't want you on this road. So by putting the adjustments back into the spine, there's a possibility we can literally go this way, right? So this is about sleeping specifically. So again, when I'm looking at these x-rays, yeah, I'm gonna look for, you've got the loss of curve. There's a little reversal to the curve there. There's a couple discs that are starting to get a little degenerative. You might not be able to see it on the video too much here, but all I want you to do anyway is the global positioning for the sleep. So I'm not gonna get too detailed into this. But yeah, of course, we're gonna look at those things. We're gonna look for bad stuff like tumors and signs of infection and the bad things that any medical radiologist is gonna look at. But in addition to that, we're looking at posture also, right? Because your biomechanics tell everything. So looking over here, this hip is higher, this one's lower. There's a little curvature in here. And I'm gonna take a special note. Can't tell if you can see this on the video, but in this area, there's a little curvature here. And there's also the bra strap. And I can tell you, in 15 years of doing this, I've noticed degenerative disc where the bra is. What does a bra do? It compresses tissue, doesn't it? And what did I just explain? I said compressive forces, immobility, compressive forces, stops the motion of the spine. That's what starts this. So when you're wearing a bra, what does it do? it compresses your spine. And for 15 years I've known this, but I haven't really been able to kind of articulate yet because there's not a whole lot of evidence on this. We know that if you fall asleep with a bra on, you've got a 60% increased chance of breast cancer. That's true. So that's what we do know. But I can tell you, when you're wearing one, it can do that. It can cause that little curvature into the spine, and that can accelerate that degenerative disc. I've seen it for 15 years. Whether or not there's evidence published in journals on this, quite honestly, I don't care. I don't. Because evidence informed says what? What does evidence informed say? I'm interested in the human person. I'm interested in the person on my table, their history, their life, what their work is, what their job is, what their environment has been up to this point when they come see me, right? That's evidence. We got to think about this. You can't look through a rat lens, an anamorphic lens or reality kaleidoscope, and come up with solutions from a rat, or even a gerbil, or a chimpanzee. Are you human? That's the question. Anyway, sorry I get off on this. What we want to do then when we're sleeping, one of the things too, when I look over here, now she's not too bad, it's hard to see from the video, but I want to see and make sure when I look at that x-ray, I don't see this. So if I see this on this view, what are you going to recommend I'm going to do? It looks like they're sleeping this way. Why? Because gravity's pushing it down that way, and most of us, because you didn't watch this video, you use a small pillow and you're compressing it this way. We see that on the x-ray. So you can see yourself doing this. You don't have to have x-ray. You can look at a photograph. You can look in your mirror and see if you're tilting your head. If you're tilting your head one way, what I want you to do is what? If you're tilted this way, I want you to sleep that way. Now, gravity gently is going to come and pull that back down, right? So that's one method I'm looking at when we're sleeping, right? Now the other thing is your pillow needs to cover the distance from your shoulder to your ear, right? That's a thick pillow, isn't it? It's not easy to do. Two ways. One, purchase a pillow from us, the custom one I talked about earlier. And the second way is what? Take a blanket or a towel, put it down, put your pillow on top of it. That's going to bring it up so that your head is in that fixed position. You're not doing this anymore. So again, doing this, what are you doing? You are literally compressing the cartilage and nerve tissue. We don't want that. Do that for a year. Do that for 10 years, 20 years, 30 years. And what do you have? Just from sleeping wrong. What do you have? Boom. See? So sleeping environment, critical, as you already learned. And in terms of the lower back, right? So two ways that I want you sleeping. From the x-ray, I'm going to determine specifically which side I want you on when you're sleeping. That's critical to know. Sometimes if you have a lumbar curve, this person doesn't, too bad, a little bit here, but I would want gravity pushing it that way, right? So that's kind of your curve. And I want gravity to gently push the opposite way. So to do that, we're going to put a pillow between your knees. And I always do this experiment with my patients. I say, first of all, you can do this right now. Stand up and march in place, close your eyes, and then stop. And then look down at your legs and knees. This is comfortable for you. Now, put your feet together, which you can't see me doing, but put your feet together. Within a few seconds, typically that's uncomfortable. If you did it long enough, it's going to be painful. Why on earth would you do something like this when you're sleeping? Get it? Relax. That's your normal posture, right? Same thing, we're going to get oriented again. Do this. That's messes with your equilibrium, your proprioception. Stop, look down. What you'll notice if you check, your knees should be about 2 fists width. You'll be able to put 2 fists between your knees. That's how thick the thing needs to be between your knees. Whether it's a stuffed animal, whether it's your spouse's leg, whatever it is, that thick. That is going to neutralize your pelvis, right? Now, we have chiropractic work to do, so this is how we do this. I then assess these areas, both from your physical exam, where I'm looking what we call spinal dysfunction, spinal decay, subluxation, the springiness to the joint. I'm targeting that. It takes about 2 to 3 months, depending on your level of activity. Literally, every adjustment, what is it doing? Remember the scar tissue? It's breaking down that scar tissue. So it's the repetition of these adjustments breaks down that scar tissue. These collagen fibers are supposed to be parallel are now doing this because of immobility. Yes, and injury. Yes, I get that. But 80% of it, immobility. Are you moving 15,000 steps a day, right? So all of that repetition, 2 to 3 months, now we've got parallel fibers. This is the theory here. Now that motion's restored. So now that that motion is restored, every time you do what? Every time you move 3 minutes for 30 minutes, if you follow me, that brain, which is mechanically sensitive, is getting the neural input to the brain. Now it can lay down the right protein synthesis for your DNA. Now your genetic expression can express healthy genes. This is what we're learning. And 2 weeks ago, I just saw a study out in Singapore where they're relating tiny movement, mechanical motion and movement with your microbiome. And that if you don't have the right movement in the body, your bacteria that lives in your microbiome can literally go from being normal to pathological, right? So we don't know yet, but I'm kind of predicting already just from following this, we're talking possibility we're going to find information to show how this leads to things like cancer and tumors. We already have proof of this when you sleep with a bra on, that compression when you're sleeping, right? 60% chance increase of breast cancer. And I'm just pointing out to you here, bras cause degenerative disc. I see it all the time on the x-ray, and it's never addressed, ever. So bottom line is 2 to 3 months of these repetitive adjustments, just like bodybuilding. We want to repair that normal motion to the joint. And once you've restored that, you're going to move for 3 minutes every half an hour. And literally, every time you do, you get that windmill of the spine going. This is called mechanotransduction. And again, another part of that emerging mechanobiology research, where we're transforming the mechanical movement energy into nerve impulse. That's what you can think about. What's cool about the cartilage is that cartilage is made up of chondrocytes, which are the cells of cartilage. And so what happens, mechanotransduction is what's responsible to born or to birth cartilage cells. Meaning in theory, we can regenerate cartilage. Now in my office, when people stick with me for that prescribed time, there's 2 ways you can do it. You can do 2 to 3 months of that care, and then if you really want to address the posture issues, some people have more scoliosis, they're going to go up to a year or so, right? Some even beyond that, depending on the level of activity and everything. But what we do is we take another x-ray, and literally what I'm finding these disc spaces. Again, you can't see it too well on these x-rays, but these dark spaces are where the discs are. And when they degenerate after chiropractic care, I'm getting patients where that space is increased, meaning we took a degenerative disc this bad and got it that way again, which we thought was impossible. It's not. Cartilage is avascular, right? So the nutrients you get doesn't come from the vascular system, right? Again, this is the problem when you're only looking at blood and you're only looking at blood biomarkers, which is conventional medicine. You gotta think about the neurology. It's the central nervous system that controls it all, even your cardiovascular system. So by the way, how does cartilage get nutrients into the disc? You need gravity. We know that thanks to NASA. And what else? Gravity. And we got that hydrostatic pressure, don't we? Like a strut or a shock absorber. It's diffusion. Diffusion is what gets the nutrients into the disc. But you gotta have the right kinds of omega-3s we talked about. You gotta have your vitamin D3. You gotta have your collagen synthesis from eating animal meats and fats like bone ribs, bone chicken, these things. That's where collagen synthesis comes from. So anyway, I'm covering a ton here, but it was supposed to be just on sleep, and here I go. So anyway, hey, that's the idea. And what we do then, here's your example of the pillow I showed you earlier. So this part here is going to be for the back of your head. So when you're on your back, like this, it forces that normal curvature of the neck, right? Because your cervical spine is the arc of life, we call it. That forces that normal curve. Oh, it's so comfortable. And then you're going to put a pillow under your knees, which you can't see, just imagine. And that's how you're going to sleep on your back. On your side, you roll this way, and this is measured from my shoulder to my ear. I can't compress that cartilage. I can't disrupt that nerve tissue. So that's what we do. And that's it. So anyway, hope this helps. Lighten up, move better, and live fuller.